So Paul, we are end of your journey with us. So,
yes.
So tell me about your symptoms and what made you to seek help.
So I had chronic groin ligament. Keep calling it ligament. It's actually a tendon.
Tendon, yeah.
The adductor.
Yes.
Isn't it?
Yeah.
And I had it come a couple of years ago, and I went to see another physio, and unfortunately they didn't really get to the bottom of it, and then I let it carry on a bit. And in the end, to be honest with you, in desperation, I was talking to a friend of mine, having a pint on Friday night, and his name's Paul Reedy, and he recommended me to try you, so I thought I'd come along. And then straight away, I could see that you were much more knowledgeable in this area. You gave me the right exercises to do with the squeezy ball and the rubber bands, and we did some really good stuff with the Shockwave treatment, and it's made a difference now. I'd say it's probably got to 90-95% better.
So obviously you had it for about 3-4 years.
Yes.
So it's been a chronic thing as well.
It's been 2.5 years, so it is chronic. Yes.
And what sort of things you felt when you're doing, what sort of activities you felt before you saw me? When was it?
When I finished playing squash, in the hour or two afterwards, even just trying to sit down and stand back up again, or I could feel just doing those sort of squats in the shower afterwards. It was catching whenever I stood up, when I went upstairs. So it was slowing me down, and it was beginning to worry me because it was getting worse.
And you've been doing exercises where they get easier as time comes in?
They do get easier, and the rubber bands and the squeezy ball have definitely made a massive difference as well. And you need to be disciplined with them. You need to do them at least 3 or 4 times a week. Otherwise you won't get the benefits of it.
And the Shockwave is slightly painful treatment we used for you because it's so chronic.
Fine.
Yeah.
It wasn't really painful. Nothing to talk. The first session was afterwards, it was a bit sore, but then after that it's less sore and less sore and less sore.
And when did you notice the difference when we started using Shockwave? Was it after a few sessions, or when did you start?
I noticed it pretty much straight away. It's really started to get better and better. So it's difficult to say whether it's the exercise or the Shockwave. It's a combination of both, but it's definitely much better. It still gets some slight discomfort sometimes. And it can spasm a little bit, but it's not painful anymore. And
do you notice it day to day life? Do you notice it?
I can tell after a game of squash that it's getting better and better. Because I'm not in pain anymore.
So the important thing is to keep up the exercise for another, the 2-3 months after. Keep the flexibility, because as you get older, you lose the flexibility as well. So main thing is if you keep that, then it will not come back. But if it comes back, you can always redo the course.
I will be.
So generally, you're pleased with the.
I'm very pleased. Excellent.
Somebody was thinking of doing, the combined treatment of exercise and Shockwave for this condition. What would you say to them?
100%. Yes, I had it for 2 years. It's only the last 6 months since we've been working together that it's got any better. So, proof's in the pudding.
Thanks, Paul, for your time.
It's a pleasure.